Welcome to the office.
Hi.
Hi.
Welcome back. Happy Saturday.
Happy Saturday to you too.
Yeah, so how are you? We had one visit.
Yeah.
You came for your back, your hip.
I came for everything.
Everything. So tell me, how did you do with your first adjustment? Good, bad, doesn't matter, just what's different?
It was good. She told me to walk for 15 minutes, so I walked around. We were on level P3.
Okay.
And so I walked around and then I walked up the hill.
Mm-hmm.
But then when I came back down, I had this catch in right in this area.
Okay.
And so
It was stuck.
Yeah.
Okay. It wasn't a sharp stabbing pain, or was it?
It was both of them.
Okay. All right.
And so I said, okay, well, I'm going to have to cut it short because I don't know how long it's going to take us to get home. And I can't see at night.
Okay.
So, but it took us 40 minutes to get here, but it took us 2 hours and 10 minutes to get home.
And then how were you when you got home and slept, woke up the next day?
Well, because I was sitting so long in the car, I gotten stiff.
Okay.
But then the next morning when I got up, it was better.
Okay.
But it was still.
And your driving is normally 40 minutes to an hour to get here, correct?
Yeah.
Okay.
Well, today it was shorter because it was the weekend, so it only took about 25 minutes.
Okay. What else has changed? Anything else? No?
Mm-mm.
Okay. Shall we continue?
Yep.
Now, we have one thing we're going to change up for your drive, okay? And I'm going to have you use it. We're using these discs, okay? They're little inflatable discs.
Mm-hmm.
We're going to take a bunch of air out of it, but I want you to stand up for a second. I want you to sit on this. And we're going to just this has a little bit more air right now, but watch, sit on it.
Mm-hmm.
And this is something you're going to use in the car, you're going to use at home.
Mm-hmm.
And what it does is you can always wiggle a little bit so you don't stiffen up.
Oh,
Okay.
while I'm driving.
Yeah.
Oh, okay.
So it's not normally used for that, but what I did find, if you take all the air out, it's just a little movement.
Mm-hmm.
It's just enough.
Mm-hmm.
Okay, and I'm going to be doing a video and explaining it to everybody when I go on our next trip to Dubai on Wednesday.
Mm-hmm.
I'm going to show you how to use it on the plane too. There's a lot of really cool stuff, and it's like so cost effective.
Really?
Yeah, just a little. It's called.
'Cause I have a small one like this, but.
I'm gonna let you borrow one.
This
I'm gonna
one
let you
is-
borrow one today, so for your drive back, you don't stiffen up, okay?
Okay.
And then you're gonna practice sitting on it every day,
Mm-hmm.
as much as you can,
Mm-hmm.
okay?
Okay.
Just wiggle around. Just wiggle around. Cool?
Yeah.
Set her up on the chair. Let's get started. We gotta go deeper, lady, not lighter.
Yeah.
That disc is great, and I like this side,
Mm-hmm.
so the butt doesn't fall asleep.
Oh, okay.
Okay, both sides are good.
Mm-hmm.
I like that one.
Okay.
Okay, and she'll give you the recommendation for it.
Okay.
All right, slide over to the right,
All the way down.
in the center, right there.
Okay.
Yeah. All right, let's see what we got today. Oh, Cherie. Yeah, Cherie got a lot of stuff going on here, you know. She had back surgery, she had the screws removed, and that was your choice, right?
Yep.
Starting at the base of the neck. C1, left side, 5 points. Make that a little lower, C3. It's a little lower at C3. Let's continue. All right. What do you got going on for the holidays? Family time?
We were invited to my god sister's house, but I just feel like I just want to stay home, enjoy the holiday with my sister that lives across the street,
Okay.
and my niece, she'll show up.
We're going to continue on the tailbone, sacrum, and up in the penthouse. And T6. Okay, so today we're getting 3 spots, C3 area, T6, T7, and down in the sacrum we're going to do static palpation, running my fingers down the spine. More tender when I push there or there?
No.
Neither.
No.
You on any pain medication today?
Yep.
What are you taking?
Naproxen.
Naproxen.
Mm-hmm.
Okay. I'm personally not a big fan of a muscle relaxer because the muscle is what's going to hold it.
Mm-hmm.
It's your choice if it was prescribed, but I would rather you stick to some sort of pain management or anti-inflammatory versus a muscle relaxer.
Okay.
Okay? That's just my opinion based on, because what happens is when we're making the adjustment, it's that muscle that's going to hold it. Once it's healed,
Mm-hmm.
then it'll do its job.
Mm-hmm.
If we start to relax it too fast, nothing's going to hold.
Oh, okay.
And you actually, in your situation, you'll get a little more unstable.
Oh, okay.
You feel that one?
Oh, yeah.
This is L5. This is S1.
Ew.
S2.
Ew.
S3. S4. S5. Still down low. All right. Center on the chair for me, please. I'm going to do S5. And let's check the neck.
Oh, I need to take my head off.
Thank you. C2, 3. Hold your head for a second. So we're going to do S5. We're going to do, actually we're going to do C2. You feel that one more?
Mm-hmm. Right there.
That's C2. Okay. We're going to do C2. We're going to do S5. Then I'm going to have you come off, and we're going to tune up the knees, the ankles. I'm going to work on the hip today a little bit too. Okay? You ready?
Yep.
Showtime! C2 we're going to take from the, actually C2 is on the right, C1 is on the left. Let's do C2. We got to get it over the atlas. Gotcha. And now C1.
Ooh.
That's the home run, lady. All right, you ready?
Mm-hmm.
Come on up.
I'm getting on that.
Oh yeah.
Okay, I got it.
You got it?
I got it.
Did you find yourself yesterday a little less hunched over?
Yeah.
A little bit, right?
Mm-hmm.
Good. Let's go face down. Hands forward. And then I'll have you slide up a little bit, please, ma'am. All right. Cool. Showtime. All right. So what I did was just I raised the pelvic piece up just to get a little. I raised the pelvic piece up to relax the low back because she's hunched over.
Mm-hmm.
So we wanted to create a little bit of that flexion. S5. Easy peasy. Hi!
Oh!
That's the
Lord
home
have mercy.
Now I'm holding, lady. That was a home run. All right. Awesome. Sweet.
I noticed when I was going to sleep the other night.
What'd you notice?
That when I lay down on my back, I was able to lay a little flatter on this side.
Cool.
Because that's where the majority of the stiffness is.
Let's go back down. Back down. Let's do a reset. Face down. And we're going to do the AS. Pelvis. I'm going to be on your right glute, ma'am, okay?
So go up some more?
No, I'm just letting you know I'm going to be right here.
Oh, okay.
Okay? Right there. So I'm going to hold the left up, push that right down. A little bit more. Can you handle one more?
Yeah.
Gotcha. Booyah. Hi. push off. Take your time. My hand is right here on your left side.
Okay.
Take your time, please. There's my hand. Check it out.
Oh, yeah. So let me see.
Mm-hmm.
Yep.
Mm-hmm.
I think I need one more.
You want one more? Come on. She asked for it. Okay. Face down. Now what I'm doing is I'm dropping that piece back down, the pelvic piece.
Mm-hmm.
It should be, it's easier now, right?
Yeah.
I didn't have to lift it up. So what we did was we set the S5 sacrum along with the AS pelvis.
Mm-hmm.
By bringing this back down, it's going to bring this slightly forward, which is what we want.
Oh, okay.
I'm holding the left. A little bit more. I'm going to go down lower. There. There you go. Sweet. Alright.
Now, is that from the scar tissue from the back?
Yes, ma'am.
Okay.
I'm working through all that stuff.
Okay.
Hold my hand when you're ready. Cool.
Yeah, because that's what I've been thinking, that it was all of the scar tissue from the surgery.
Yes, ma'am.
Oh, wow. Ooh.
Tell me.
Ooh.
What?
I was able to get this back.
Mm-hmm. Hold my hand. You can take a bigger stride.
Mm-hmm.
Look up.
Oh.
Yeah.
I'm so used to doing it.
Turn. Let's change the habit. Look up.
Oh, yeah.
Turn around. Have a seat. Good times. Good times, lady. Good times. Oh. Check it out. This is after adjustment. S2. Forward. Whoa, 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 whoa. S4. S5. Different?
Oh, yeah.
Yeah. It's moving.
Mm-hmm.
So if you can't walk, let's say, too much, use the pedal machine, please.
Pedal machine?
Yeah, we'll make a recommendation to get a pedal machine. You get them on Amazon, they're like $35.
Okay.
And they work amazing. I just want you to get your movement, your motion.
Oh, so
And
it's
just-
like a bicycle
Yeah, it's
pedal?
just
Oh,
yeah, it's a
okay.
little pedal machine you put on the floor.
My sister has one of those.
Shoulders, drop. Nice. Shoulder. There you go. Go on your back, please. And let's tune up your feet. Sweet.
Will I be able to wear my heels?
Yeah, for Christmas. Get yourself some nice 6-inch heels. Yeah!
I got some.
Uh-huh. Raise the right leg. A little easier, right, to lay down.
Mm-hmm.
AIN femur, AS talus, posterior tibia. There you go. All right, young lady, we're all set.
We're done?
We're done.
Wow.
Stick a fork in her.
Okay, let me see if I can do this. Oh. Yeah.
What are you doing?
This in here, stretching this.
Pretty cool, huh?
Yeah, because it was really tight in here, and then I don't feel any pain in this sciatic.
Okay.
right now. So
Cool. Good stuff, lady. Stand up for me, please. Turn. Stand up straight, please. There you go.
okay.
Squeeze. Squeeze. Hands are good. God bless.
Thank you.
You're welcome.